Yeah, no issues. Everywhere it's a different experience, and that's good.
And by now, I think the flyover is completed, no? The new one?
Yeah, flyover
Guwahati?
completed. In Guwahati, all the flyovers have been completed.
My goodness. And the kind of infrastructure, the kind
Yeah,
of development that comes in there is very fast,
very
I
fast.
see.
Yeah. Now there is another bridge over the in the Bhorolu area.
Uh-huh, uh-huh.
Another bridge across the river.
Yes, yes,
So
yes,
that
yes.
will directly connect us with the North Guwahati.
Ah, I
Directly connect
see, I see, I
from
see.
Guwahati. We don't have to go to the Jalukbari and Maligaon and take a
And then turn,
detour. Yeah,
yes, yes,
long
yes,
term.
yes,
Yeah,
yes,
yeah,
yes.
yeah.
All right. And how is Shillong treating you so far?
Yeah, very good.
No, because every time we go to Guwahati, we go down to Guwahati. I mean, when we come back, it's always you can always feel this difference in terms of the weather, in terms of the air, and all that.
See, now when so many constructions are running in the same time, at
Yes,
least
yes.
the air quality will just will be poor.
Mm-hmm.
We
Right,
can't
right.
help it. We are the
Yeah.
two other medical colleges and so many flyovers are they're making in the same go within 6 months.
I see, I
So air
see.
quality is little bit poor, I must admit now. And whenever there is a rain, following rain 2 or 3 days, it's good. After
Mm-hmm.
that, again the same thing happens.
I know, I
The
know, I know.
population also has increased exponentially now.
Yeah.
Yeah.
I mean, thankfully, I just saw the news that Guwahati got the award, no, for the cleanest capital here in the
Yeah, yeah,
Northeast,
yeah.
which is very impressive, actually.
Now it has become cleaned up almost.
Yeah, right, 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 right. I mean, we have noticed that in the
Yeah,
past few
yeah,
months that we visited,
yeah.
but sadly, Birnihat, which is very near to us, with the kind of population, with the kind of pollution that it emits from all, I'm not sure where, but it has become one of the most polluted areas in the country. Actually,
Barnihat is the industrial zone.
exactly.
Industrial zone and unregulated almost for a
Yes,
long time.
yes,
Now it
yes.
needs a stricter regulation, I think.
Yeah, I believe
Waste
so. I believe
disposal,
so.
pollutants, and they need a very good, yeah.
At least if that is being taken care of, I think a lot of commuters also from
Yeah, sure.
we will get the fresh air at least
Now the
only by
commuting time
visiting.
to Shillong has come down to 2 hours only. Previously,
Yes, yes,
whenever we used to
yes.
come during our childhood, it took 5 hours.
True, 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 true.
I
I still
remember.
remember.
Yeah.
Still remember. We had to take a bus from here
Bus,
and
yeah,
then go
yeah.
down to Guwahati. And I used to study there in where you have the toll gate.
Yeah.
Yeah, that we call it
Dispute toll gate, yeah.
no, it's called 20 mile.
20 mile, yeah.
Just before reaching
Guwahati.
no before reaching Bernihat. Before reaching Bernihat, there's a school. It's called Jawahar Navodaya Vidyalaya. So I used to go to school there. So back when we were there in that school, the weather was even if it was near to Bernihat, where we could still have fresh air and all that. But I think by now things must have changed with the kind of pollution index that we have in Bernihat.
Acha, in Khasi language, what is meant by the thank you means kublai.
Kublai, yes,
Kublai.
Kublai.
Yeah, yeah.
So you either say Kublai or Kublai Shibun. So Kublai Shibun is thank you very much.
Kublai
Shibun.
Shibun.
Yeah, Kublai
Kublai
Shibun.
Shibun.
It's like
Shibun.
thank you very much. But Kublai, it's more like a greet.
Okay.
You all say thank you with Kublai.
Yeah.
Or maybe if you meet someone also, you just say Kublai ba, Kublai kong.
Kublai Shibun.
Yeah, Kublai Shibun can be thank you so much or thank you very much. Yeah, I mean you can always do that. You can
Sure,
always,
sure. No issues. No issues.
All right, are we on? Done yet? Okay, ladies and gentlemen, welcome back to yet another episode of Shillong Talk of the Town podcast, where we usually bring a lot of people in this podcast, in this show, sharing their expertise, sharing their story to inspire you, to inform you about so many different things. We have had a lot of people coming here, sharing their take on their career, their life, and we've had a lot of friends. We have a lot of musicians, politicians, and people from all walks of life that we have seen, we've witnessed, and we've had a conversation with here in the studio. And today it's quite a special episode, I must say, to be able to host one of a very esteemed guests all the way from Guwahati, and that is Dr. Joy. Dr. Joy, he is. I will leave him to do the introduction himself, but he is here on a very important mission, and that is to address one of the critical issue that especially for men, if I must say, that we many of us are facing, yet maybe most of us are in denial, so to say. And maybe most of us also do not know with the kind of condition that we
Yeah.
have as men. So Dr. Joy here is here to explain to us and help us understand a few things when it comes to prostate health, and few things that relate to what he does best, let's say, and also offer us a solution, also offer us, let's say, a walk through what it is like to be prostate healthy, if I can put it that way. Because the doctor here is one of the most qualified, if I can put it that way, here in the Northeast, with a lot of qualification and experience over the past 25 years. He also run a urology center there in Guwahati, which he will be explaining more about it. But doctor, thank you so much for being here in this show. And you've traveled all the way from Guwahati just to be in the show. Thank you so much for that.
Thank you, Ferdinand, for giving me this opportunity to talk to your show. It's always a very pleasant experience on my part, I must say. And people of Shillong and the surrounding areas, as well as the whole of Meghalaya. So today I will tell something about, it's an awareness program. We must say that this is not marketing or something like that. It's a just awareness program for the common people, normal people who don't know actually what is prostate. Most of the people usually don't know what is prostate, how it grows, and usually it affects men. So today I will try to cover some of the important aspects and to correct some misconceptions
Yes.
regarding the prostate. So
Right.
that's my goal today, and it's completely an awareness program.
Right.
Yeah.
So let us start off with maybe something about yourself. Who are you? What have you done? And what do you do right now, doctor?
Yeah, I'm a very senior urologist here at Guwahati, and I passed out MS and MBBS from Gauhati Medical College long back in 90s. After that, I went to Delhi, Calcutta, and in Delhi I was working in government hospital in initial 10 years. After that, I left government hospital and I was working in Max Hospital for few years. And after that, I shifted back to my native place, that is Guwahati, and I was working in Apollo Hospital
Right.
for long 10 to 12 years from 2010 onwards. And after that, just after the COVID, I went to my UK place again,
Okay.
and I was working in NHS, National
see.
Health Scheme, England. That's the government of England for almost 1.5 years. And then I came back and opened my own clinic here, mainly keeping in view that many people in our country can't afford all those expensive multi-speciality hospitals or corporate hospitals. So in a corporate hospital, I am just bound to treat on one section of people. Most of the people, they don't know where to go, or sometimes they get too much drained financially in a bigger hospital. So in my clinic, my motto is that I can treat the poor also. And I also selected some of the hospitals where I can operate them and in a low cost, very low cost. So people don't have to get worried about the cost bearing and sometimes that. And that is the one. St. John Hospital is here. There are several hospitals like that. Chakraborty Christian Hospital, St. John Hospital, where can I put my patients and operate there at a very low cost, which is nearby half or 1/3 of that what we expect the patient to cost in a big corporate hospital.
Okay.
So in that way, I'm trying to help out to and reach to those people who
I
are
see.
in need.
I see.
And regarding my study, I did MS and MBBS at Guwahati. And after that, I passed Royal College of Surgeons FRCS Fellowship
Alright.
of the Royal College from England, that means from London, Glasgow, Edinburgh, and I'm also a visiting faculty at Edinburgh University. I need to go there every 6 months for
Oh,
a few days
okay.
to have study and also online. And also at the same time, I'm doing my PhD work at Guwahati University, IIT Guwahati, and I'm
I see.
working on there's some biomedical devices which is working on prostate.
Oh,
So that's
okay.
one my research aspect. I'm doing PhD in that.
All right.
So
All
that
right.
is running, and I'm getting a very good help from IIT people. That is my passion. You can say that research. Yeah.
So, doctor, if maybe before going into the topic, let's say, I just want to understand you as a person. Why did you choose, let's say, urology as your, as your specialty, and what makes you take the decision, to specialize in urology, and why, what was that in the very first place that
Yeah.
make you took the
Very,
decision?
it's a very good question. So of asking. Most of people, whenever I was in, during my childhood, uh, when I was around 2021, first year or second year MBBS, at that time also, 20 years ago also, there is not so much awareness regarding prostate or stone, which are urology subjects. Usually general surgeons used to treat all this. And I saw my father was going repeatedly to urination during night time. Sometimes, whenever he was nearing 80 years of age, my father used to lose urine, leakage of urine also. Then I was worrying about that, what has happened. And then I took my father and I studied also. At that time, I was studying MBBS. So then I came to know, okay, this aspect is not altogether addressed in our
see.
population, and most of our people don't know what's happening to their elderly fathers and elderly people. So they are having problem in urine and passing urine and sometimes leaking urine and straining to pass urine. Urine is not coming. Takes long time to pass urine. So all these things are due to prostate, and these are all urological issues. So now, whenever I was studying MBBS and after that MS, the urology has become completely altogether a different super specialty subject.
I
So
see.
then I choose this subject that yes, it is still not addressed by the common population, and people used to go to several general physician first, then MD physician, and after that surgeon before going to urologist. Nowadays there are many urologists. At that time there was very very less number of urologists, and people awareness were also very low. As I have already told, I couldn't understand why my father was going to urologist while studying first or second year of MBBS. Then my teachers told me, this is due to prostate, and that happened. At that time, Professor R.K. Mohanto and Professor P.M. Deka was working in Gauhati Medical College, and we have a urology department there. Yeah.
I
From
see.
there,
I
I
see.
developed my interest to study this urology, what it deals with. Actually, it deals with the whole prostate, the kidneys, both the kidneys, kidney stone, and then ureter, and both ureters come and urine drained into a urinary bladder, and that is the storage organ. And urinary bladder, and we let our urine to go outside. So in male, from the urinary bladder to the urethra, that is the water pipe,
Right. Right.
there is one gland. That gland is called prostate.
Prostate.
Now, every male person has got prostate. Once a male child is born, he is having prostate. Prostate is not a disease,
Okay.
that I must say.
Yep.
And as the age of a person increases with age, that's after 45 years or after 50 years, the prostate starts enlarging. That is called benign enlargement of the prostate. So after 45 years, you see the urine flow is not what was having 10 or 15 years before. A person having 25 years of age, the urine flow is better. Once he reach the age of 40, 45 or 50, his urine flow becomes less.
So that is because of prostate.
That is because of the prostate. Prostate is enlarging with age. So
I
that is due
see.
to the
I
prostate.
see.
And once he reach at the age of 65, 70, 75 years, prostate go on enlarging and enlarging. But it's not bad. Prostate enlargement is not a disease. Benign enlargement of the, we in medical terms call it BPH or BEP, benign enlargement of prostate. Whichever nomenclature you adds to it, actually it is a benign enlargement and there is nothing to do. Most of 99%, now 95% of the people have benign enlargement. It grows with age, just as we have graying of hair. Do you need any treatment for graying of hair? No. We don't call graying of hair a disease. Then similarly, a prostate enlargement is also not a disease.
I see. I see. So does the kidney has anything to do with it?
No, kidney don't have anything into it. And prostate enlargement, there are many treatments. Prostate enlargement. I will come in this issue a little later.
Okay. So if we talk about, let's say, prostate and prostate health and all that, I mean, I believe you must have, let's say, an opportunity to visit Shillong or any hospitals here in Shillong also, or maybe any other part of Assam and Meghalaya, if not Shillong. How has people, what have you noticed in terms of the perspective of people regarding this sickness, or if not sickness, let's say the prostate health in general?
Sure. You are very right in saying that. People usually come, they don't know that they have prostate. And once most of the people come with a ultrasound report to me. And in ultrasound, somewhere the radiologist has written, the sonographic people has written that there is prostate is enlarged. Once a person see that my prostate is enlarged, there is panic attack.
I see.
He thinks that person usually Google it or tell something, and there are lots of misconceptions about prostate. In Google, you see it is the Google search or YouTube search is AI powered. And once you search one thing, the next thing come, all the bad things will come spontaneously without your okay. And a simple thing has become a complex. He become mad, he become panic, he don't know what to do because the sonologist or radiologist has written that he has a 30-gram prostate and below a small letter enlarged prostate. Now he don't know, he don't have symptoms. A 30-year people or 35-year people or 40-year person, male person, he don't know what to do with that report. Only 34-gram prostate or 30-gram prostate. Below it is written prostate is enlarged. Now he go around. Some people have started some medicine. Now it comes the awareness should come from this point of view. A 40-year people, if come with a 30-gram prostate, he don't have any symptoms, only a piece of paper that is radiology done for something else and came out to be a 40-gram prostate written by somebody. Then it becomes a very, very alarming thing for that patient.
I see. So now, when does it become alarming then? If just enlargement is not an issue, then when does it become a threat then? Or maybe if I can just put it, when does it become a cancer?
Cancer is completely a different thing. I must say that only 5 to 6% people have cancer.
On prostate.
And that also in aged people, 60 years and more.
All right.
Most of the people who come with prostate problems, there are some symptoms which differentiate. Because a person at 50 years or 55 years age, he will notice that yes, he has to wake up at night 2 or 3 times. Before he didn't used to wake up, now wake up 2 to 3 times. Second problem starts urgency. He can't hold up urine. Once he feels that he has to rush. This is the second symptom. Third symptom, he feels that I need to strain a bit, give pressure to pass my urine. And after passing urine also, he feels that something is inside. He didn't completely void the whole amount.
Yes.
And at night time, he needs to go to toilet many times. So these are the symptoms which are first symptom for benign enlargement of the prostate. That is benign enlargement. This is not the cancer.
Okay.
Now, if a person thinks that he is disturbed by the symptoms, he should consult a urologist. Now, there are
Okay.
several urologists. Any urologist at any city, he can consult. Now, treatment starts not from the medicine. That is the most interesting thing we must speak about. Once a 50-year or 55-year person, male person, approaches a urologist with all these symptoms, first thing we need to take a detailed history. In the history, we need to see whether that person is having constipation or not, whether there is a stool problem. If a person is having a stool problem, constipation, then the urine symptoms might be due to constipation. Once you relieve the constipation, 50% of the symptoms are over.
Oh, okay.
Secondly, these are the conservative lifestyle measures. Secondly, we ask the people how much water you have taken during your night time. So we need to reduce the water intake after 6 or 7 p.m. and avoid fizzy drinks, that means Coke and all these things, and tea, coffee, which are caffeine containing and irritates bladder. So we need to contain these after 6. Before 6, any type of water, any drinks, but after 6 p.m., it is better to reduce the water intake so that he don't have to go to toilet 3 or 4 times. Now, avoid constipation. So these are the lifestyle measures we ask this patient, and then ask him to come after 1 month. If the symptoms are mild, and usually the symptoms go with the lifestyle modification, don't need any treatment.
Okay. So, why do you think if I think you must have had patients coming at the very, let's say, not at the early stage, but later, because they do not understand, or they do not notice, or maybe they do not know what is the problem, but comes maybe a bit late, so to say.
Bit late.
Yeah. So why what could be the problem? Is it embarrassment? Is it not knowing, or is it lack of information about it? Or
see,
what have you found?
You are right in saying that. Many people they take this completely as a private matter. So they don't want to divulge what is happening inside a toilet, because passing urine or passing stool is completely private. Any people don't accompany a person in the toilet and see how he is peeing.
Yes.
So now many people suppress the fact that if I tell this, might be with the misconception that he has heard from somewhere. Once I go to doctor will cut my prostate. So this is the misconception. Doctor never asks for the prostate for surgery unless the patient himself wants surgery. That means we need to see few things: how the patient is embarrassed by his problems, what is the quality of life, and how is his flow. Now, first we don't ask for an ultrasound. The first thing we do is take history and then ask for a uroflowmetry examination. In uroflowmetry examination, what happens? We ask the patient to pee in a bucket type of machine. So in that, we determine what is the flow pattern and how much urine he is passing per second. And that detects the prostate. Ultrasound we don't do for the prostate. Only to see the size of the prostate, ultrasound is not done. Ultrasound is done to see how much urine is retained inside his bladder after peeing. That is called post-void residual. I think I am clear.
Yes.
One thing should be clear: it is not the ultrasound in the first way. First, we need to do a history, then do a uroflowmetry test. After uroflowmetry, we ask that person, get one ultrasonography done, not to see the size of the prostate, to see how much urine he is retained inside the bladder after passing the urine. And size of the prostate comes that information comes as a bonus. But the size of the prostate does not dictate whether a person needs surgery or not. A person might have 100 grams of prostate, but his flow is good. He don't need surgery or medicine if he is happy with his flow. So we must take into account how the patient feels with the big prostate. is his flow is good or not. If he feels that he is passing urine comfortably, then why we should advise any medicine or surgery to him? So we need to take into account the quality of life and the flow, whether he is happy with his flow or not. So this is most important rather than dictate. So the dictation for medicine or surgery should not come from the doctor. It should come from the patient. If the patient says that, yes, I have completed your lifestyle modification advice, and still after that also, I am feeling little bit discomfort and I'm trying hard to push my urine, then we'll start some medication.
I see.
That means there are some alpha blockers. There are many things in the market with the different brand names. The alpha blockers are tamsulosin, alfuzosin, and silodosin, all these types of. And before advising these medicines, another thing I need to stress here, we need to see the age of the patient. We need to ask the patient, because he is a male patient, we need to ask, it's our duty to ask the patient, what is his sex practice? If he is sexually active or not.
Does that
yes, that has a bearing on the selection of the medicine.
Oh, all right.
If we give tamsulosin or silodosin without discussing all these issues to a patient, he is 60 years, he might have or 65 years, 70 years, whatever age maybe, he might have a very good sexual practice at home. And if we, without asking all these things, we straight away write alpha blocker, tamsulosin, there are many things in the market. Tamdura, Urimax, Veltam, silodosin, that means silodal D8, these are all brand names. Then immediately what will happen, after 3 days the patient will stop ejaculating. So ejaculation will be stopped. His semen will not come out.
All right, because of the
many
medication.
patients came to me because only they complained about that they have a problem in peeing. Prostate is enlarged, flow is low, and doctor has advised them alpha blocker, tamsulosin or silodosin. So these medicines, without saying that, these medicines may cause stoppage of the semen flow. Sperm will not come out because the bladder is relaxed. His urine flow will be improved, no doubt, but the semen will not come out. Semen will come out while he is peeing with the urine, mixed with the urine.
I see.
So that becomes a very alarming. He can't tell to the household members also. He can't tell other friends also. He is taking medicine. Or he is suffering silently and taking the medicine for months without telling the doctor, yes, doc, I have this problem. Out of some fear or out of some embarrassment or some privacy issues, he may not discuss all these things. So I think we need to discuss everything in detail with the patient. Because if he is having sex problem and he is really worried about that semen is not coming out after taking all these medications, then we need to alter the medicine to alfuzosin or some low dose tadalafil.
So does that let's say the sperm count or maybe the flow, let's say, of the semen will be impacted because of prostate condition, or
it is due to the medicine? It is the side effect of the medicine.
But is there any possibility that can happen because of prostate issue?
No. Prostate issue never cause ejaculation problem or sex problem.
I see.
Prostate, don't worry. But at the same time, we take the history for another reason. There is in menopause. Have you heard about the menopause which happened in females?
Yes.
That means they have stopped menstruation, and due to some hormonal issues. In male also the same thing happens. Many people don't know, and that is called andropause. As we age, our testosterone level cut down, decrease. And after a certain time, the desire issue and the sexual performance issues, this crop up bit by bit, and that is due to androgen, less androgen. So we need to discuss everything in detail, and we need to give time to a patient. 10 to 15 minutes time is good, and we need to discuss everything and then prescribe whatever is good for the patient, not hurriedly just write few medicines.
All right. So if there are those watching who think like maybe this cannot happen to me, this won't happen to me, what would you like to say to them? I mean,
See,
a lot of us who are healthy, who are young, and say, maybe this is not really an issue. Maybe.
every person will have a prostate. Every man, all male person will have prostate. Will have
Yes.
prostate at some point of time. But the problem is that every person will have enlarged prostate. Suppose at the age of 20 or 25 years, it is 20-25 gram prostate. At the age of 40, it becomes 30 gram. And at the age of 70, it becomes 60 gram or 70 gram prostate. So that's the normal evolution of the prostate. So
Alright,
nobody can stop it. Prostate will grow in size. And that growth is due to some hormonal imbalance, as I have already
Yes,
told
yes,
you.
yes.
And second issue is that on ultrasound is very imprecise.
Okay.
So one should not believe the ultrasound, take medicine, and sometimes people think that, yeah, I have taken medicine, my prostate has gone down, the size. Okay. Because on ultrasound, the size of the prostate is measured by a computer.
Okay. Yeah.
That is the abdominal ultrasound, and that is very, very inaccurate and imprecise method of measuring the prostate size. That's why I have told that if you see that your prostate size is 40 gram and after 6 months you are taking medicine, your prostate is 30 gram. So don't think that your prostate has gone down in size.
Okay.
So that is a misconception or wrong conception, because
Right.
prostate size, nobody can exactly tell you how big is a prostate. Yeah.
Okay. So if that is the case with men, you're saying that after 45 years and above, this could possibly happen. But does this, have you noticed or have you experienced, a case maybe that happens with younger aged men?
Yeah, I'm coming to that. This is a very, very good question to have asked. Younger men. There are few personalities.
Okay.
Type A personality, type B personality. In younger people, prostate is not enlarged. But some people, young people, 25, 30 years people, come to me
Okay.
to have doc, I have a very poor flow of urine. So most of these cases are due to bladder neck, functional bladder neck stenosis. Now I am telling you the hypothesis behind that. You see some people, they are very, very careeristic, very, very perfectionist. They want to make everything perfection. Yeah, very, very, they think everything at a high level. Yeah, I need to go there. My job is there. I should have a high flying career. It takes lots of tension in daily life. The small things also, in every small thing they take tension because they want to get it perfection. So that type of personality, we call it a type A personality. So in these people, in young people, there is a continuous adrenaline rush inside the body. Okay?
Okay.
And this adrenaline rush, that means this norepinephrine, this cause functional obstruction of the bladder neck. Prostate is not enlarged, but the bladder neck is stenosed because there is some muscle at the bladder neck which are very, very sensitive to this constant adrenaline rush.
Oh,
So,
my.
yeah. So, in that way, though young people might not be, but the number of persons are very few. And these are the persons also who have the IBS, irritable bowel syndrome.
Yeah.
These are the persons. So, type A personality have IBS is more, and this functional bladder neck stenosis. So, in those people, we need to assess them, counsel them. We need to tell them in details what to do and what to think, less your tension to keep
Stress life. so to
stress
say.
life, avoid that. So
Alright,
these things help a lot. Yeah.
I see. So which means the prostate will have no impact, so to say, but the bladder would have some
Yeah,
kind
in
of.
those person, the
Yeah.
bladder is more irritable and there is bladder neck stenosis.
All right.
And there is little bit, I am telling a little bit, it's a medical term.
Yes,
There
yes.
is, you can say that it's a mild narrowing of the bladder neck. When you do
Okay,
cystoscopy,
okay.
there is no actual block.
So, but it is curable.
No, it's curable with medicine. The patient remains okay for years. But if after taking medicines and is having very poor flow, Then we have to sometimes, in very, very few cases, we need to do surgery. That is the bladder neck incision. But very less number of cases. Most of these people, we ask them, reduce your stress, complete your family, and then because incising a bladder neck, operation on a bladder neck, anything, whether I perform surgery on a prostate or bladder neck surgery, it is irreversible procedure. Number one, and the person will never pass antegrade, that is normal ejaculation will be lost forever. So before doing all these surgeries, we need to counsel the patients. See, you are young, and you didn't have complete your family. So continue with this medicine. Do Kegel exercises. There are some exercises. We ask them, reduce your stressful life, avoid constipation for young people, and continue this medicine till your family is complete.
My goodness, this is the first time I'm hearing that stress can actually...
stress can in young people.
My goodness, I think our viewers should take note, especially
many things in our life, many things comes from stress. And medical science anyway is not it's not a pure science. There are many plus minus, and in medical science 2 plus 2 never becomes 4. It may be 5 also, it may be 3 also.
So what are the misconception then about prostate? I mean, you have highlighted a few, but like the most common misconception that could be of I mean, as simple as it's something that comes in naturally and you don't have to take care of it, and like you said, it with age comes the enlargement and all that. And maybe most of us who knows think that it's okay, it's a normal thing, we shouldn't be too...
That's why we need to counsel to the patient. We give enough time for a patient to counsel. And it's our duty to make the patient aware of his body system, how it's working and what is prostate and what is the... We do few things. One thing I have told you, uroflowmetry, ultrasound to see the PVR, and one PSA we do, that is prostate specific antigen. If it is less than 4, there is no risk of prostate cancer or something like that. And then we tell, yes, you have some symptoms I noticed. After lifestyle modification is the first step. Second step is the medicine. Those medicines I have already told you. Then we have to discuss all the sex issues with the patient. And then select the correct medicine for him, which will work. And then tell him, okay, see, all person in this world, male person in this world will have prostate at some point of time. And as you grow older, your prostate problems will become worse, or it may remain static. Prostate sometimes may enlarge year after year, but the symptoms may remain static with medicine. So 90% people, they remain in a static condition, but with a good flow and acceptable flow for that patient over the years, many years.
I see.
Only 10% of people need surgical intervention. So then also before surgery, we have to ask the patient, how you are feeling? Do you feel your flow is very bad? And lots of urine is retained. Suppose a person is retained inside his bladder, 100 or 150 ml or 200 ml. That is called chronic retention. So in that condition, we ask the person, yes, it will be a better option for you to go for surgery rather than to wait for medicine. And because there is another aspect, if a person grows more residual urine inside his bladder, now at a time, usually there is an interplay between the bladder pressure, bladder is contracting and urine is going through the prostate. Now some point will come when the prostate becomes too much enlarged and it squeezes the water pipe. Now, if the bladder pumps also, the bladder fails to squeeze all the urine from the bladder to the water pipe because of the blocking prostate. So, in that condition, after a long time, the bladder will surrender. It's a long time, I can't push much harder. Then the residual urine will start growing inside the bladder, 100 ml, 150 ml, 200 ml. So, in that people, in this type of people, we usually ask, it's the time to get operated.
Okay. So, So in this case, if operation is done, I mean, how what are the procedures? From screening to the operation, and like you said, maybe it is irreversible. What then after the operation, or what is the
See,
condition of the?
prostate operation is an irreversible procedure, and after a prostate operation, the ejaculatory power is lost. But remember this: ejaculation is only one of the aspects of sex.
Okay.
The other sexual functions remain as it is. So,
Alright,
if one
right.
thinks that after a year only all the sexual function will be lost, it's not like that. Only ejaculatory power will be lost.
So erectile
After
function,
surgery.
will not
Erectile
be there.
function will remain same.
Okay.
Number one point. Second, there is lots of misconception. There is, see, marketing people will come with the laser surgery and all these things. I can tell you in a very vivid way that there is no term like laser surgery in any department. Laser
Okay.
surgery is not there. Laser is an energy. The
Okay.
surgery name is something prostate surgery. The prostate surgery may be TURP. It may be, there are several types of energy we can use and then do the prostate, remove the prostate. So most of the people has got a 30 gram, 40 gram, 50 or 60 gram prostate. For them, using laser is, I think it's a wastage of money, and sometimes it becomes a opposite and more complications. So once a prostate is more than 70 or 75 gram, then only using laser is good for that person.
I see.
Otherwise, TURP is still the most beautiful way of removing the prostate. And most of the worldwide TURP is used. That is, in short, it is called transurethral resection of the prostate. In layman term, we pass some instrument through the water pipe and remove the prostate bit by bit by diathermy current. Diathermy current, bipolar diathermy or monopolar diathermy. So this is the most commonly used.
So it's more like you reduce the size of.
Yeah, we remove the prostate.
Okay.
The whole of the prostate is not removed.
Right, just
Only
part of it.
80% or 70% of the prostate is removed, so that
see.
mechanically there is a very good channel. So after
Alright,
operation,
alright.
after I remove the pipe for after 1 or 2 days, the person will be in a very good flow and he is happy.
Okay.
Yeah. And only laser should be used only when the prostate size is 75 or 80 gram. Not because the only one doctor or one hospital has brought out a new laser machine. And because, see, technology is for human. Human is not born for technology. So we don't use all these lasers and all these things as a cannon feeder. So we do not feed our patients to this technology. We should select which technology is better for which patients. So if we use laser in a 30 gram prostate or 40 gram prostate, the results may be detrimental. It may be bad. So the prostate must be 70-75 gram minimum size to use a laser machine.
All right.
So many of the people don't know, and they go for all these marketing hype and YouTube hype and all these things.
Okay. So, I mean, I'm not sure with the exact term, I mean, to put it, but if we talk on something like a success rate in terms of how well the patient recover and does not have any issue anymore, how do you ensure that with surgery? I mean, does that? Is that cure permanent? That the patient does not have any problem anymore after the surgery, or do they face or find any kind of new symptoms or issues?
You are very right in saying that. Because of this, I am repeatedly telling that we should give time to the patients for the first consultation, for second consultation, and when we select that, we tell a person that surgery is an option for you, and what surgery to choose, and how to choose, and what might be the complications, side effects. We must tell the patient in a very, very detailed way, rather than going, I tell that you need surgery. The word for surgery, I should not dictate to patients that, yes, your prostate is big, you need surgery, otherwise you will this and that happen. This should not be the sin. We should not scare or make the patient afraid of. So it is the patient option. So I will give the patient, these are the options at this time, and you choose your option and then let me know. Now,
Okay.
these are the options. And if you don't do surgery, what may happen? If you do perform surgery, what will happen? After surgery also, there are several complications, side effects, which may happen. Although in less number of cases, out of 100 operations, 5% of patients may have some sort of complication. Sometimes bleeding, sometimes infection, sometimes the balls, testes become infected and gets enlarged. We need to do bilateral vasectomy and some long-term antibiotics. So these some things can happen because all these things we need to ask the patient in detail. Sometimes after giving antibiotic also, these things can happen. And stricture is another complication. Sometimes because the instruments which we use for surgery, that's a little bit bigger instruments. We need to dilate the water pipe and then use the instruments. So after keeping, suppose it is a very big prostate and we keep the instrument for 1.5 hours
Okay.
or 2 hours to remove a big prostate, then stricture formation is more. So here comes the expertise of the urologist.
I see.
Here comes the expertise. How much time he need to bring out the enlarged gland. If it is 45 minutes or within 1 hour he brings out it, almost it is good. But if a little bit inexperienced person try to do it, and then if it takes 2 hours, then 2 hours a big rod staying in the urine pipe, then here comes the little bit of experienced person should operate on these things. Stone can be operated by many people, but I think prostate should be operated by an experienced person. There are many urologists who can perform it.
So, talking about accessibility in terms of these kind of treatment and all that, especially here in Meghalaya and also Assam, let's say, how well do people get access to a good treatment and get a very proper kind of a guidance and consultation in terms of prostate as far as
See, first
this
of
is
all,
concerned.
I should suggest that whenever a patient select any type of treatments, whether lifestyle modification, medicine treatment, or surgical treatment, he must talk in detail. And
Okay.
it's the duty of the urologist to give enough time to that patient. Because whenever I talk to a patient or I make a patient counsel, I am not doing a favor to my patient. It's the opposite. My patient is giving his time to me. Without my patient, my value is zero. So it is the time the doctor should give enough time for the patient. Don't hurry. And I should advise my patients give enough time and say that the doctor, please tell me what are the complications side effects may happen after surgery, what surgery you are going to do, and what complication I may expect. And if any complication happens, what is the treatment? Is there any treatment available or not? Or I should be breathing in pain. And I'm coming from all the way from Shillong to Guwahati, or sometimes many people goes to Chennai, Hyderabad. Many people come to us after doing surgery in these places. But sometimes we should not take a very what I tell you, commercial attitude in all these things.
Okay.
We should give enough time. That's the last word, enough time. We should take the patient empathetically, what he wants to say,
Right.
how much money he have. If he can't afford a very big hospital, no big hospital admission is necessary. It can be done in a smaller hospital also. In a smaller hospital also. And there is treatment for everybody. And government hospital, again, it's a good hospital. The people again have misconception that people don't want to go because they have a long list and long line. But ultimately in government hospital, they are doing very good. In Shillong also, in Meghalaya also, there are several good urologists now come out, several juniors. So you can show to them everybody is equally good and they are better.
Okay. So talking about your center in Guwahati, I mean, you mentioned at the very beginning regarding providing a center, a healthcare for people who cannot afford, let's say,
Yeah.
a proper healthcare in this regard. Can you be more specific on the kind of treatment that you offer, and how do people
Yeah,
avail
when a
this?
patient, this is a very good question. Sometimes patients from far off place or from staying in a village or outskirts of Shillong and all these things. So they become sometimes very, very confused where to go, whom to meet, and how to address the problem. My father is having a prostate problem, where to take him? Now, the first thing I need to stress on this, just avoid middlemen and all these things, marketing people and middlemen, you should avoid. Directly contact any doctor you like, anywhere. At Shillong also and Guwahati also, anywhere you like, contact a doctor directly, talk to him. If it takes 2 to 3 days, doctor is not there, if you like that doctor, go to him, talk in detail, and then, because in that way you can save a lot of money if you avoid marketing people. I think I'm giving enough.
Yes.
And second thing is that before approaching a very big hospital or this corporate hospital, I think it's better to see a doctor in his own chamber or talk to him or give us WhatsApp when he is available, and then see where the doctor goes and what is the comorbidities of the patient. If a patient is having lots of other problems such as sugar, heart problems, then it is better to do in a bigger hospital. If he is almost don't have any other problems, only mild sugar and blood pressure, ECG, echo, everything is low risk, then we can perform all these surgeries. Or any doctor, any urologist can perform all the surgery in a mediocre or smaller hospital where the cost will be reduced to half or 1/3 of what is costing in a bigger hospital. So all those who can't afford also, I don't think there is no point of despair or getting confused about all these things. There is a treatment for everyone. In India, it is really very, very, in UK it is, or USA, it is very costly. All surgical treatment in India, it is really cheap.
So,
But still, we can't afford.
but let's say the treatment is, I mean, you've made the treatment affordable that way from your end, from your clinic, from your center. Now, but is there any kind of follow-up procedure that you follow in terms of, after the surgery or even after the treatment? Is there any kind of follow-up that that require them to come and then visit you? Or
For those patients who are having medicine, we first start medicine, lifestyle modification, and then ask the patient to come. If everything is okay, to come. First visit is after 3 months. And if the patient is comfortable with medicine and lifestyle modification, then my duty is to call them every 6 months, not so early. First visit at 3 months and then every 6 months visit to see the uroflow. Or you can get the uroflow done at Shillong also and many places where the uroflow is done. Ultrasound is not so important, but you can get ultrasound at 6 months interval or 1 yearly also. So it's not a very big issue. Those patients who have gone their surgery done, so I don't let them come to some other cities 2 days after removing the catheter. That means there is a pipe inside the after surgery. So I remove the catheter and look for any bleeding or sometimes recurrent bleeding, so that they don't have a very tough time while coming from distant places. Once they return to the distant village, it's very difficult for them to come again. So there is really lack of faith and all these things. So that's why I say that we should talk each and everything in detail and take care of the patient. And then we need to select the patients on the basis of their comorbid diseases. Comorbid diseases means whether if a person is 80 years, lots of problems, we need to operate in a bigger hospital that is safe. If not so much more problem, then in a smaller hospital, that is good. Usually I segregate in that way, and my poor patients I operate in Christian hospital, that means St. John Hospital or Chhatribari Hospital or some other disciple polyclinic in that way. and bigger all those who have problem in Health City or Apollo Excel Care hospitals. So we need to segregate the patients. All patients we should not do, otherwise the expenditure will be too high and it's really alarming. Most of the persons they don't, and avoid middlemen, come directly, talk directly with the patients.
Yes.
Yeah.
So now, doctor, speaking of the kind of, I mean, that the age that you mentioned for people, for men who have crossed the age of, let's say, 75, 80 years and all that. Now, of course, one thing is maybe could be ignorance, could be that they do not understand so many things about their own body and all that. Now, I think you must have had patients coming with their family members, could be with their wives, could be with their kids and all that. Is there anything that you would that you would tell these family members, the kind of treatment or the kind of caretaking that they need to
understand.
do for
I understood
these
you
aged
what
people?
you want to hint at. Sometimes, because I have already told you, the peeing or passing stool or passing urine is a completely private subject.
Right,
Nobody
yes.
takes anybody's relatives inside, even if wife. They don't allow.
Yeah.
They went inside a toilet and then shut the door and then pee. So now how to recognize? Suppose that person is not telling that I am having a problem.
Yes.
His wife must have observed that he is waking up every hour or every 2 hours to pee. Go there and take long time to pass urine. He don't come out so easily. So normally a person takes 30 to 40 seconds to pass urine. Normal people like you and me. Once we develop prostate, then the duration of peeing increase. So these things are the most important thing. And last of all, they don't. You see, an older person is hurriedly going to the toilet and passing urine, takes long time. This is the first red flag. This is a first flag sign that his spouse, wife should pick up. That, he is going so urgently to the toilet and is spending so much time in peeing. And after that also he came, after half an hour he again go, or after 2 hours again go. So these things will make an alarm. So I said then he should be taken to a doctor and then ask what is the problem. And then everything, once history is taken properly and if a urologist gives time, I think everything can be unearthed.
All right. So I mean, prostate is let's say a male organ, so to say.
Male organ.
But is there any kind of similar issues with women also?
You are covering almost everything.
I'm just curious. I mean, this is all new to me. So
in female, there is no prostate. Number one. In female, one thing happened that I must tell you. In female also there is, in some people, 50% of the people who are post-menopausal. Post-menopausal means once they attain the menopause, their estrogen hormone level reduce. Then what happens? In female, the genital area and all these things and the urinary hole, everything comes out from an area which is highly dependent on estrogen hormone, female hormone.
Okay.
So once a lady attains a menopause and her estrogen level goes down, then what happens? The urinary area, the whole area becomes little bit whitish in color and shrinkage. So that is called atrophy. Little bit of atrophy happens. And in that process, sometimes the urinary hole, that means what we call urethra, through which the urine come out, the hole becomes a little bit narrowed down. So in that way, 50% of those people who are post-menopausal, 55, 60, 65 years, they sit almost long time in urine and passing urine in a very small. But that is not prostate, that is called post-menopausal urethral stenosis. It is the ideal medical term. That's called narrowing of the
channel.
urethra.
I see. So, but is it a problem or?
It's a problem, but we see whether the lady is having, sometimes urethral dilatation is done or urethroplasty is necessary in a very, very rare cases. For most of the persons we do, over dilatation is also a very bad thing. So we first thing see uroflowmetry, and then we have to calibrate the hole. If the hole is yes, okay, little bit, it is admitting 16 French catheter or 18 French catheter, we don't do dilatation because over dilatation is bad. 16 or 18 French pipe once insert inside the hole, it is good, acceptable.
All right. I see.
So it's a simple thing.
Okay. Now, I heard actually prostate. I mean, let's talk about prostate cancer, doctor. If we may.
Sure.
I mean, I've heard about this term a few years ago. I think this is the first time that I'm getting like a first-hand information about what it is and all that, and a very detailed explanation. I tried googling it in the past because we have one program that supports men's health, which is support these prostate cancer patient. Since 2017-18, we've had that kind of program, but I have very less knowledge about it. Because maybe there is lack of awareness, there are lack of let's say lack of information from the could be from the administration side, let's say, or from the concerned authority that's supposed to to hand out a few information leaflets or anything as such. Because before hearing that term prostate cancer, I thought that men does not have anything as such. When I heard that, I'm like, okay, men also do come across a problem like that. But until today, I was not sure what it is and how does it happen. Now, if you can walk us through what prostate cancer is, how it is treated, how it is identified, and what is the treatment like?
Yeah, you are right. Prostate cancer is a very tricky subject. I must say that all persons, I have told you, all persons at some age will have prostate issue.
Right.
When an enlargement of the prostate.
Yes.
Only 5 to 6% or maximum 10% people have some cancer prostate.
Okay.
Now, how we recognize cancer prostate? Because once a patient came, we do ultrasonography and then do PSA. PSA is a blood test that is prostate specific antigen. If it is more than 4, then we have to recheck it.
Okay.
Recheck it and see whether the PSA is increased or not. If a person came with a PSA 8 or 10 and having some prostate issues, then our pathway of diagnosis is a little bit different. The symptoms will be same, but PSA is more, then we advise that person to have a MRI of the prostate and pelvis. And then MRI can pick up, if MRI picks up some suspicious points inside the prostate, then we perform some biopsy, that is needle guided biopsy. So this is the pathway, diagnostic pathway protocol in case of prostate cancer. Now comes the main issue, whether prostate cancer needs treatment or not.
Okay.
It is completely wrong that all prostate cancer needs treatment. If you see 80% of people more than 80 years of age has some prostate cancer focus inside the prostate, although it is benign enlargement. Sometimes we do prostate surgery, and after prostate surgery we send this for prostate, and 18-year people, 50% of the person come, there are some prostate focus, cancer focus.
Okay.
That depends on the Gleason grade. The grade of the focus is 2+2 or 3+3, 6. So these are insignificant prostate cancer. So prostate cancer is not a thing. If a person is having a prostate cancer after 75 years, be sure about that prostate cancer will not be able to kill that person. So it is insignificant. So no big surgery or no big treatment should be done on this prostate. So after 75, at 80 years of age, as the person grows older, the prostate cancer becomes indolent. Indolent means it is harmless. Becomes. Okay. But if a person is having a 55 or 60 years of age of patients, having a prostate cancer, in the same pathway, diagnostic biopsy, prostate cancer, then we have to look into what is the grade of the prostate cancer or stage of the cancer. Then treatment will be done accordingly. Yeah.
So then in that case, if a patient finds out after all the tests and procedures have been undertaken, um, what do you usually suggest in terms of taking care of one's health after this patient?
After 50 years, one should have a PSA test, one test. And that is more important for those who are having their first degree relatives. Suppose brother or father is having a history of prostate cancer. So that person must do a PSA test because there was a history of prostate cancer in his family tree. So those persons should have a PSA test every year after 50 years. So that's to be on the safer side. But those who don't have any history of prostate cancer in his family tree, first degree relatives, father, brother, or something like that, then I don't think it's a very alarming issue. And PSA is a number only. Just try to remember. Up to there are many things written in the report.
Right.
It is not right that it is more than 4. It is 5 or 6 and the person is having a prostate cancer. It is completely wrong statement. So in these people, we need to just see, when a big prostate can give rise to high PSA. Even an infection within a prostate gives rise to high PSA. So a raised PSA or high PSA does not tell that the person is having a prostate cancer. Yes, it is suspicious. We must go for the MRI and biopsy. And if biopsy tells it is benign, then it is due to the enlargement of the prostate due to chronic prostatitis. It is not due to cancer. So it should not be alarmed. And if there is no medicine to reduce the prostate, it is unlike many people come to me, doctor, give some medicine to reduce the PSA. My PSA is 5 or 6, it is raised. Then PSA is a number only. There is no medicine to reduce it. And we should not go for the reducer, artificially reducing also, because it is an indicator.
All right.
That's all.
So now, for let's say for a person like you have been treating and then come across a lot of people and patients with such kind of sickness. I mean, it's okay if you don't want to share, but has there been any patient or cases that really encourages you? Because I'm sure that you've been working a lot in spreading the awareness regarding the sickness. I mean, through let's say throughout your career, making people aware about what the sickness is all about, and then up to a point that you are making affordable, a treatment for the community. But is there any kind of cases that really reminds you, that really encourages even people also, other patients also, that okay, this patient has come, or any kind of success story that you have had with your patients along the way of your career?
When a patient is really having prostate, see, we have to first diagnose a prostate case. If a person is really having a very, very tough time in passing urine flow is narrow, and he has a bigger prostate, after surgery, he will get 100% relief, and it is very, he will come with lots of gratitude. Yeah, doctor, I am relieved of my symptoms and what I was feeling outside. And that's a very good thing for us to realize. And at least I have given some sort of relief to that person after surgery. But in some people, what happens, I need to stress this fact also. A person who is having diabetes for a long time or some other problem, as I have already asked, some spinal cord problem, or this bladder is not pumping properly. So in these patients or patients who are having long-term diabetes, the nerve fibers which are supplying the urinary bladder, these become affected. Okay, so in these patients, we need to do one urodynamic test and cystoscopy before performing any surgery, because that will answer whether surgery will relieve them or not.
All right.
So straight away going for surgery is a wrong way of treating them. So in these patients, one cystoscopy and one urodynamic study will tell that bladder is pumping. If the bladder is pumping and then have enough power, then only prostate surgery will be effective.
Okay.
Yeah.
But has there been any cases that you have to remove all of all of the prostate?
Yeah, there are several cases we are doing it. Now number of prostate cases have gone down. There are several good medicines now in the market.
Okay.
Now lots of money. Now only 10% of patients need surgery. So monthly our number of surgeries has come down. If we really and ethically I practice, the number of prostate surgeries they have reduced over the years now
Is it because of the awareness?
because of the awareness and medicines. Awareness, medicines, avoid constipation, lifestyle modification. Now everybody know almost what is prostate and in what way my lifestyle should be modified and what medicine I need to take and need to take the advice of a doctor. So in that way, 90% of people remain static or their lifestyle has improved quality of life. So they don't need any surgery. So what we were operating 20 years or 25 years, our seniors were operating, senior doctors. Lots of, prostate operated. That scenario is not there. If at this age, at present, if any urologist is just ethically practicing, he will have less number of prostate surgery. That I can tell you.
Yeah, I hope so too. I hope
Yeah.
so too. So, if there's anyone listening, there's anyone watching us here and listening to this conversation, but who have not been to a doctor for so many years, thinking that I've been well and things is well with me and all that. I mean, do you think that even without any problem, do you think they should get themselves screened or tested, or and which is the nearest, or what would you advise? Where should they go?
Nearest. He should show any urologist who is in his town or nearby town. Or if he has just frequently come to Guwahati, or if he wish to come to Guwahati or some other Calcutta also there are flights. Anywhere, it is better to see a urologist, get your symptoms screened verbally and get an uroflowmetry and ultrasound done and see what is the condition running and one PSA. The doctor will write medicine, or if you don't need, the doctor will not write medicine. Only simple lifestyle modification will do for you.
Okay.
So any nearby urologist, everybody is good. There is no point in that. So in Shillong also there are many urologists who was working, and they are my brothers and their colleagues, and they are good.
So now, if suppose if somebody is facing a problem, and somebody is, let's say, if they are hesitant in going to a doctor and then show themselves to a doctor, maybe because of so many reasons, let's say, what could happen? What is the worst case scenario that could happen to a person because of prostate problem?
One thing I have already told you, if a person is having less straining to pass urine, less urine is coming out, and urine is getting pent up in his urinary bladder and staying there. So he may end up in having a catheter. So someday he will completely stop passing urine. His lower abdomen tummy will be full with urine, and he then need to go to a nearby hospital, put a catheter. Then the operation will be some emergency. So I think we should avoid that condition. And sometimes that also happens in cool climates. When there is winter season, that may happen also.
All right. No. I mean, what I mean to ask is because I've heard a lot of these bladder stone and all that. Does that turn into bladder stones or something?
Yes. Chronic retention. Chronic retention means the person is not keeping lots of urine inside his bladder without knowledge and passing a small amount, and lots of urine is inside. So that becomes a gutter water. That means a drain-like water inside his urinary bladder, and there the nidus of stone formation starts. So that is a secondary stone, and when the stone formation happens inside the bladder, that becomes an absolute indication for surgery. So we should take precaution before that. That will be a very appropriate thing.
So talking about Shillong or Meghalaya as a whole, you being stationed in Guwahati, how frequent do you get cases?
Almost daily basis we see 15 to 20 prostate cases per day. And most of these cases we follow up. Only monthly few cases we need to operate, not more than that. Only few cases who are really in trouble and need a good surgical relief. But here the problem starts. The urge for operation should come from the patient. He should tell that, doc, I am having very, very problem in passing urine, very narrow stream. Lots of time has been passed for in peeing. So give me relief. I need surgical relief because medicine is not working with me. I have started and continuing this for 3 months or 6 months. Then we'll talk with the patient, as I've already told, counsel the patient. Then we do a cystoscopy and see whether really it is prostate which is blocking or there is some other block inside the urine pipe. Because male urine pipe is 20 centimeter long.
Right.
So there are many factors. So we diagnose it properly and then perform surgery.
Okay. So, apart from prostate treatment that you provide from your center in Guwahati, I mean, what are the other kind of sickness? What are the other kind of treatment that you do apart from that?
Yeah. We have at the beginning of this show, I have already told you our discussion. The urinary system, urogenital system, it starts from our both kidneys.
Right.
The kidneys stays at our upper abdomen, upper tummy, and there are two water pipes comes, small water pipes, and pour urine inside our urinary bladder from which the urine is passed. So kidney, small water pipes, kidney pipes we should take, then urinary bladder, prostate, kidney stones and testes. So these all the things including genitals, that means male and female genitalia. So all these things comes under the purview of urology department. And here we should not confuse with the nephrology, because nephrology deals with the medicine of the kidney.
Okay.
Urology deals with the surgery of the surgical aspects of the kidney, prostate and all these things.
All right. All right. So if there's anything that has to do with the kidney
medicine,
okay.
That's what nephrology.
All right.
Yeah, nephrologists and urologists are completely different. One is surgical branch and one is medical branch. Okay. So only kidney medicine that nephrologists deal with that. Yeah.
So if there is let's say a set of things that one needs to do, maybe for anyone who has crossed the age or has a father figure at home or an uncle at home who has already crossed that certain age, that the number that you've mentioned, what are the kind of healthy habits that one should follow?
Yeah. Number one point is to avoid, it is better to cut down on red meat. Better to cut down.
Right.
But I know that most of the northeastern states, their meat is it's a part of a culture. So I must say that we should continue this taking meat, but it is better to cut down. Okay. Because ultimately the meat will cause constipation, and constipation will increase the urinary problems also.
All right.
So more fruits, that is helpful, and more fibers in diet. More fibers.
All right.
More fibers in that, so that avoid constipation and a good sleep and regular walking. So these things will help. And most of this, out of all these things, little bit, if we swear from something, that is one thing is called adda. Adda means talking with the peers, friends, and having a good time in the evening with a cup of tea at 5 p.m. or 6 p.m. with lots of friends and discussing all these things, and remain little bit walking, and these things will really help an aged person.
All right.
You need a mental support also. So these things will help. A small gathering with friends. Those persons who don't have friends, they have less time, they suffer more. At least you need someone to tell your story. Yeah.
So if that's the case, do you think that drinking or smoking habit can also contribute, or what do you think?
Drinking habit is not so important. Drinking, I think a moderate drinking is okay, because usually people drink at 6 p.m. 6 p.m. if a person drinks, then drink works as alcohol works as what we call diuretic. That means it makes the kidney to form more urine, alcohol. So that's why you see after taking alcohol, people go to pee more and more. So if a person starts taking alcohol at 6 and 7 p.m., so by that time he completes his peeing, it is 10 or 10:30. So it is okay if he takes one peg or two peg at 6 p.m. or 6:30 or 7 p.m. But not after that, what I suggest.
Okay.
If he takes at 8 p.m., 9 p.m., it will be a problem for him and wake up at night. And smoking also, it is a little bit, we should avoid, because smoking, the tobacco and all these things, the irritate the bladder. So the frequency will go on. The urinary frequency will increase if we continue more smoking. So in moderation, if a aged person is having smoking and drinking for long time, we should not say that you stop everything. It is a completely bad idea. You continue everything, but with moderation. That's I say.
I see. I see. I mean, that- there's a huge population that involves in all these habits. So that's why I'm just asking. Now, I mean, I think we've covered almost
Yeah, we've almost,
everything.
yeah.
But on a personal note, doctor, I mean, you have had patients, you have had people coming to you for so many kind of problems. But all in all, in general, how do you see, I mean, men and their lifestyle being compromised just because we don't know things like these? Because I mean, for me, if it was not for this podcast, I think I will not be having this kind of information unless I have a problem with my prostate, so to say. And a lot of us also, a lot of us who are watching this podcast also, I think it's a new thing. It's the first time to listen, to hear something as that. But all this while that you've had patients, that you've had people coming to you, what is that one thing that men in general would do to avoid doctors, and then avoid consultation, and then do something else? I mean, what is the problem with men, do you think, when it comes to this kind of health?
I think that it's from both sides.
Uh-huh.
Avoiding a doctor is there are problems from both sides. Patients also thinks that doctor is just I'm going to a doctor and I become a more patient. So sometimes it is correct also. His conception is also correct. Sometimes you see the doctors are writing so many medicines which are not necessary. Only one or two medicines are necessary. Rest of the things are nutraceuticals or additives. Yeah. So these things we should avoid. And second is that we should not, doctor also should not scare your patient or make the patient afraid. Yeah, you will have that and you will do that. So all these things, that's why I told you to avoid marketeers. Avoid marketeers and directly talk with the patient in detail and go with the doctors who give enough time to you and understands you. And ultimately, doctors are also human beings. We don't have everything in our hand, because I've already told that medical science is not a pure science.
Right.
2 plus 2 never becomes 4. It may be 3, it may be 5 also. So doctor will try their best. And something also, we also believe in God. Because have you seen the thing in every prescription, we'll see that one RX is there. RX means take thou in the name of God. That is a Latin term. So in the prescription of every doctor, when you see the name of a doctor in the form of RX, have you seen it? I think in all doctors are written.
Yes, yeah, of course,
RX.
of course. Yes,
Before
yes,
starting
right,
the number of medicines,
right,
they have
right,
said
right.
RX. What
Yes.
RX means? It means take thou in the name of God.
Oh, like that.
That means I am giving medicines, but the God will heal. But it's not like that I will shed all my responsibility to God. It's not like that. But we also believe in God. And what to the young generation I told that, see, our life priorities will change year by year. So one decade by decade, after 10 years, every person has got their life priorities changed. And something will happen to somebody and some disease will come at some time. We cannot avoid. Some are God gifted. Some we should not just neglect or ignore our problems. We should go to doctor and see and have a very frank discussion with the doctor and spend your life. All the male persons have a good life. They should live a full life with all the things what they want in life, including sex, to the
Coming-
fullest.
Doctor, coming to that, thank you for mentioning. I mean, I'm not sure what the entire urology scope covers into, let's say, that you take into your scope or into your field of work.
Yeah.
I'm just asking this question maybe for a few of the individuals there, maybe who are struggling with their sex life, maybe with some kind of a sexual dysfunction of any sort. Do you cover? Do you?
Yeah, we cover all this. That is the
Okay.
andrology section that we cover also. So these things also need a little bit of good counseling.
Right.
And most of the things are psychogenic. One thing I should stress on this factor, in male sex problem, almost 95% people they are suffering from psychogenic sex problem. That is, it is coming from the mental block. Once they cannot perform, they think that I am of no use, because the confidence become loose. Only 5% people has got organic sex problem. So if a person is having, and smoking is a big cause for that. That's why smoking is also, it should take in a moderation, reduce. If a person is having some sex problem, talk with the doctor frankly. We have some scoring system. What is the score? What medicine he or she? What is the expectation of his spouse? So we usually counsel them if he is married or with his partner or wife.
Okay.
And you need, in that cases, you need the person who is having the sex problem need the complete support of his spouse or partner. Otherwise, it is very difficult to treat.
Okay.
That's why, yeah.
So now, if I mean, there are a lot. I know that there are a lot of people out there who are just hiding in the corner, not trying to come out and then talk about their problems and all that. Now, if there are some of them who are watching this, what would you like to say to them to encourage them to come out and then consult somebody, consult an expert like yourself?
An expert who can give time, because these things are time-consuming things.
Okay.
Because most of the urologists, they avoid all these consultations. The reason is that because it takes a long time to take history, we have to clarify, we need to these things and then give the treatment. So it is not a straightaway method. They come, stone, surgery. This is not the issue like that. So doctors, urologists who can give time only they should see, I think, these andrology cases.
All
So
right.
these are called sex problems of andrology. And we need to see the patients empathetically, not to discourage them. Take the full history, if possible, along with partner or wife, whatever, and see their previous history also. And all this history, most of the diagnosis come out of the history. And then we perform a penile Doppler and all these things, see whether there is any organic issues, see the lipid profile, diabetes and all these issues. And then we take the decision to give some Viagra type of medicine, tadalafil or sildenafil.
Okay.
And before Viagra giving and sildenafil type of tablet, we need to see what is the heart condition. So we should do a ECG or echo. If the heart is good, then only we give these medicines.
All right.
And counsel the patients also.
Okay.
But there is no point in disheartening. There is treatment. There is nothing like that.
All right. I think the same goes with women. With women also.
Yeah, women also. Nowadays, it's becoming a very popular subject. Sexual dysfunction in females. That's the upcoming subject.
I see.
And there are many things which we can do for females also.
All right. So I would I think it is right to say that if you need any kind of consultation, maybe they can just
No issues.
reach out to you.
No issues. Yeah.
Yes, okay. We will be leaving all the numbers of the center of Dr. Center here in Guwahati. And you can call and then book an appointment or even visit the center there in Guwahati. But I think let's conclude with this, doctor. I mean, you have you've done your share of contributing to the community in terms of treating people in big hospitals and healthcare systems and all that. And now you venture out into on your own by trying to make people more aware about the sickness and other things that you do, and also provide an affordable treatment, so to say, to the people, those who can't afford. What is your vision when it comes to the center? I'm not
See,
sure.
it's a
Yeah.
big clinic which is
Right.
having a cystoscopy, urodynamics, and all this uroflowmetry and all these things, which is handy and it's a quick.
Okay.
So we segregate the patients and is he really need a surgery or not? If he need a surgery, then we see the whether he can or she can afford the cost of this in a big hospital. If he wants that, he is not having so much of problem, no other diabetes, hypertension, heart problem, all these bad things are not there. It is a simple issue. Then we can operate in a smaller hospital, such like St. John Hospital or Christian Hospital or Chhatribadi. So there the cost of the treatment is almost 1/3, I think.
Okay.
Almost 1/3. So it is very much affordable for the poor patient. And for those who want a bigger hospital, so they can choose also. So our concept is that we can segregate the patients depending on their need. Because I am a visiting consultant to all the
Yes.
hospitals.
Okay.
So I
Okay.
cannot if I sit in a bigger hospital, I do OPD in a bigger hospital, then my choice is much more telescoped.
Yes.
Only those
Yes,
patients
yes,
who can afford a bigger hospital,
Right,
they
right,
will
right. I see,
they have
I
to
see.
come with me. Other patients I have to send them
Okay.
back.
Okay.
So this is the problem. Yeah.
All right. All right.
So in my clinic, everybody is open for poor also, for mid class also, for those who are affluent also. So for everybody, we have something, and we can segregate them according to their financial capacity. So that is our aim. That I should not turn away. That you don't have money, and this no money, no, come. We can do in a St. John Hospital. Okay.
I see. I see. I
Or
see.
Dishpur Polyclinic. Yeah.
Now, another question, maybe.
Yeah, yeah.
I'm just curious again. You're pursuing your PhD. Why so? I mean, you've had all covered, and you've had all.
Every person has got, very good question. Every person has got some sort of hobby. My hobby is studying and researching.
Okay.
So just coming out with a new technique, new method, some new implant, biomedical implant is always better.
So you're working at a.
I'm working on a
Okay.
biomedical implant.
I see.
So let me see how far I can go. So this is my 4th year started.
Okay.
Yeah.
IIT Guwahati, you said. No?
IIT Guwahati.
Right. Okay. So then, I would, if there's any other query that you would like to ask, maybe I've not done justice to to the interview of not asking all of the questions that you would like me to ask. If there's anything left, I would request you to reach out to doctor directly.
Yeah, next time I will come out definitely with a stone, because
Okay.
in Shillong and in Meghalaya, there is a stone problem really. Now, which stone require treatment, which stone don't require any treatment, unnecessary people are treating their stones.
Yes.
Most of the cases. So which stone
yes.
require treatment, which stone don't require treatment. So then I will tell you in detail.
Then
in our next visit.
we should have another episode on this.
Yeah.
All right. So please leave your comment. What do you think about this conversation? If there's any doubt, again, if you still have doubts, if you still have questions which you maybe you've been asking yourself or asking around, or maybe hesitant to ask people around, you can get in touch with doctor here. We can just leave the contact number that you can contact directly with the center there in Guwahati. This is in Ganesh in Christian
Basti,
right?
on the main road, GS road.
Okay. So you can just go down as well, and then
First, just the side of the Apollo Hospital, one building.
All right.
Yes.
Okay. Yeah. So it's just in the main road only. So
just
they
main
don't
road,
have to.
Main road.
Okay. So please visit if you find if there's anything that you find that there's something wrong with you, maybe something wrong with your body, and especially with the prostate
Prostate.
and prostate problem. And if not you, but maybe your elders, your uncles, or maybe your father, and anyone who may have or may develop potential kind of problem with prostate. So please reach out to doctor and his clinic there, and please leave the best comment for doctor here. And maybe if doctor here has already hinted regarding the stone topic. Maybe if you
Yeah.
can put in the comment section, what would you like us to ask Doctor here, Dr. Chakraborty here regarding stone problem? If there's any doubt, any questions at all, anything.
All questions about kidney stones are
Yes.
welcome. I will
Right,
answer.
right. So please drop in the comment. And allow me, Doctor, if I can just translate everything else that we've done, summarize it in Khasi, maybe
Yeah, sure.
for our local audience. Ti kublai porlok phi pe nadu basdang bakut lesi bun pring jong phi hakabak nadu basdang lesi pim da yo pim da sungthu than ye ke bangi keren. Tin re Dr. Chakraborty hang ni don iwan na po na tiba Guwahati Urology Center badan tiba Christian Basti ha po Guwahati. Bay keren shopang jong ka kot ka khia hakabay day bat ka jinglong shenrang. Kibala kabaju kta khamtam lele habaya day bat kini ki rangba kibala cross ni kibala petam ya kani ka sausan snem sheneng ti kidon kiba bun apdeng jongi ki bampat sunguthu lesi kani ka jingpang kalong kumnu ya kani ki jukhat ita ki prostate problem ni prostate health kiba jumi ki issue ba pher ki jinge ba pher kabaya day ba ban lej pinje ban lej pinje baka jing mi jong penje ba kumta terter ti lada don kum kita ki baro khat ki ba pisngu thu lada pilong ma phi lani ki kmi lani ki kpa jong phi lani ki mama jong phi ki bala cross ya kata ka karta ka sau san chnem shaneng khamdam lele ki bala cross ya ka nyu pho nyu san propose nem ru kumju ki bala sedang nomor kat banang he karta utau prostate gland. If it's called a prostate gland, right? Yeah, so uni prostate gland unang he udang enlarge kumta mikiong te bad nakadaw jong kani kala ban kta ya ka jinglit penje jong nu khamtam jong ki shinrang nomor udon tang ki shinrang ti bala POE lar don manum no napdeng ke yeng sam jong phi kiba shem shitom ban lej penje khamtam men mien banong balik penje banong bikin lej bun sien lani kilej slam lani kammi bha kum penje ba kumta ter philap kumita ki ke bro khoi philap ban consult ki urologist keleng tin rei hang ni ru Dr. Iwan ban yathu namta jong phi hakbai day ba kani center hang te po Guwahati ba kalong affordable ba kalong ka ba bam lese ka ba kipen yarap ye phi ban rai ban ai ru ya ka treatment ban ai ru ya ka jing sumar ka ba phi phila ban siu te kam da don kam e ba phi village ki hospital ki ba he lani ki ba bun ke jinglut tin rei da ka ba village ban consult bi doctor hang te po ka center hang te ken batai phi shakanu ka benta lani shakanu hospital phila ban lej kat kum ke jingla jong phi kat kum ke jingyo ko jong phi bat kat kum ke jingpang ko jong phi tile sing ni persang kala kad yai ban wan ra ke jing penshai ka bede kani tibat hakawai pat ka episode banging one lesi hopefully we'll have another episode with you hakabai day but kini ki mau ki badon ki bangi jio mau doctor yong ma ki babon bha napdeng gini ki nong shong snong jong jala jongi ki don ya u problem but u mau ni to stone badan haki benta jong ka kpo ni haki sang bat ki ti kini borok haj ngin sai kren pat hakawai pat kapor lesi lepidon kijing kli jong phi phila ban bu comment section kana mengi la ban address gila ban kli doctor no one biang sa shusien tinrei hadu kani klemat la pidon hakabai day bat kata ka jingli penji jong phi hakabai day bat ka shong kha shong man lesi nam tak shinrang ka center jing doctor ka dan nang tipo Gauhati Christian Basti hajan jong Apollo hospital ka phi phila ban lek ngin bu ru yin number phone nang ni phi phila ban shim ban call kana phila ban book appointments ni phila ban lej hi shethe ban ni kendu bat ba phin yo ya ka jing shakri bat kata ka jing sumar ka batikna. So thank you so much doctor for your time.
Thank you for inviting me.
And I do you understand Khasi a bit here and there?
Yeah.
You can a little bit. Okay.
Yeah.
So I was trying to explain and translate whatever we've discussed so far. But again, if they have any other doubts and queries, they can just visit the center that way. It will help them. So thank you so much for your time,
thank
doctor.
you, and thank you to all of your just viewers.
Yes.
And the people of Meghalaya at large. Kublai.
Kublai, doctor. And let me just remind you, if you are new to this channel, please consider subscribe. We will be bringing doctor again, of course, and a lot more guests into the show, from artists to anyone from all walks of life that you can draw inspiration from, and then share a little bit about themselves, about their career, about what they go through. It can become a big inspiration for you, like what doctor has shared here. And one of the biggest inspiration that I've received towards the end of the conversation is not to stop learning. I mean, at this age,
Yeah.
and he's pursuing his PhD. I mean, this is something which I think a lot of all young people, a lot of us young people should be inspired, should draw inspiration from. And there is no stop to learning.
No stop to learning.
Yeah,
It's
and-
lifelong learning.
Right. I mean, Doctor here, I've already completed, a very successful career throughout his life. Yet, going into studies again and then trying to do something different for the community. That is very inspiring, I must say, Doctor. So,
Thank you.
Thank you.
Thank you for the compliments.
Thanks
Yeah.
to you. Thanks to you. So, ladies and gentlemen, please subscribe to the channel Hashalong Tour of the Town. We also have a secondary channel. We call it Hashalong Clips, where we keep short videos, short form videos that we take from this long episode like this. We keep in topic wise, let's say 10 to 15 minutes long, or maybe just 5 minutes. And we are also on Instagram. You can also give us a follow on Instagram, where we also keep short reels. So whatever that we are discussing here, maybe in just 1 minute, you can just swipe. So we are also there at Hashalong. So you can give us a follow, subscribe, and we'll see you in the next episode. Thank you so much.
Thank you.
Thank you, Doctor.
Thank you.
That was a wonderful conversation. Thank you. All right.